I don't know why the mute button's also, the unmute button's always so hard to find when you're about to say something. But hi everyone, welcome to this session, which is called Disability Inclusion in Museums. It's the third day of the Museums Association's virtual conference. We're really pleased to see so many people here today. My name's Rebecca Atkinson. I'm from the Museums Association and I'll be facilitating today. Before I hand over to Richard Sandell, who's chairing this session, I just want to briefly run through some housekeeping announcements. Although we can't be all together in person today, please do use the chat function in your menu bar to let people know you're attending this session, say hi to each other and respond to the issues raised. You can also tweet using the hashtag Museums2020. There will be some time for questions today, so if there's anything that you'd like the panel to address, then please share this via the Q&A. You should be able to see this in the menu bar. Richard will put selected questions to the speakers, so please keep these short and to the point to help him out. This session won't be closed, so you can leave and rejoin at any time, and we are recording, so it will be available on our website in due course, which means hopefully next week, all being well. If you want to benefit from speech-to-text transcription, which is provided by Stage Text, then please click the closed captioning option in your menu bar. We've also got audio description today from Vocalize. If you press interpretation on your menu bar and choose the French option, you'll be able to hear this. I'm not anticipating any technical problems. I'm sure it's all going to run very smoothly, but if you do have any problems, send me a private chat message. That's it from me. I'm going to hand over to Richard to get the session started. Bye.
Thanks very much, Rebecca. Good morning, everyone, and welcome to this session, Disability Inclusion in Museums. A big thanks to Sam Bowen for proposing it and to the Museums Association for having Sam, James and I here today. My name's Richard Sandell. I co-direct the Research Centre for Museums and Galleries at the University of Leicester, and I'm delighted to chair this session today. We have some short presentations for you, but we're really keen to hear your thoughts, as Rebecca said. So use the chat function to introduce yourselves and discuss the issues or points that arise for you whilst we're presenting, and I'll pick up those questions. We'll take those all at the end. In a few minutes, you'll hear from our two main speakers. Sam Bowen is Museum Development Officer for the South East Museum Development Programme, and James Brandon is Diversity and Inclusion Manager at Tate. Sam, James and I have worked in the field of disability access and equality for a number of years, each with our own specialisms and focus, which we've brought to our work as advocates and allies. My own interest in this field is long-standing and it's shaped by personal experience. I experienced disability for a number of years as a child, and in recent years have learned a lot about managing a long-term chronic condition. My professional practice for the past 25 years or so in this area has been focused around stories of disability and difference linked to museum and gallery collections of all types. I've worked on a range of collaborative projects with all sorts of museums, always ensuring disabled people are at the very heart of that process of researching and interpreting these very often neglected histories, but doing so in really ethical and socially purposeful ways, ways that deeply challenge the entrenched negative attitudes towards disabled people that still pervade all areas of society. For this session, it's taking place in the year that marks 10 years since the Equality Act, but also a year that has presented museums with significant new challenges arising from the pandemic. So at this moment, we want to come together with all of you to explore together a number of shared concerns and questions. Could I have the slides up, please, Rebecca? If you just go back to the first slide. There's the opening slide, which has a picture of, there we go. It features Deaf Men Dancing, an amazing organisation led by Mark Smith. There are three contemporary dancers here in a performance at the Hunterian Museum from just a few years back, from a project we led at the Research Centre called Unruly Bodies. And these three dancers have their outstretched arms, somehow imploring audiences to listen, to take note and to take action. And it seems especially relevant for our session today. Next slide, please. As the disproportionate impact of COVID-19 on disabled visitors, staff and volunteers comes to light, these are the concerns we want to explore with you today. How can we all ensure that institutional commitments to disability inclusion don't fall off the agenda, but continue with fresh momentum and commitment? How can we centre disability access and inclusion at the core of all of our work, so it becomes a natural, a habitual part of all of our thinking and activity, not a bolt-on thing that can be easily left aside? And lastly, how do we tackle discrimination and unconscious bias against disabled people head on? And in doing so, make museums genuinely more welcoming and inclusive for everyone. Before we go to Sam and James, I'm just going to say a few more words to put our discussion in context. I was looking back, preparing for this, I was looking back at the proceedings from a conference I organised with Ethne Nightingale, who worked at that time at the V&A, and a session that Marcus Weisen presented at that conference a decade ago in 2010. At this event, Marcus Weisen gave a powerful presentation and called out the flagrant lack of concern for disabled people in museums. Next slide, please. Marcus claimed that discrimination against disabled people in museums is an unspoken practice of global proportions. And to substantiate his claim, he looked across a sample of large, high-cost, prestige museum developments. These were new builds, extensions, major refurbishments in the UK and beyond, all of which he'd visited, all of which were funded by taxpayers and therefore deserved scrutiny. And he said that none of these museums that he looked at that time, none of them made any provision for what he described as intellectual access for casual visitors who were blind. None engaged with deaf people using sign language. None had ventured to take on the creative challenge of designing displays inclusive of people with a learning disability. Next slide, please. He continued, billions, he said, have been spent in recent years on new museums, major extensions and refurbishments across the globe, all with little or no regard paid to providing a shared experience of the collections for disabled people. The cumulative effect is discrimination on a grand scale. The message given out to disabled people is clear: you don't belong. 10 years on from there, I think we can say we've seen many positive changes. Next slide, please, Rebecca. The image here is from the Being Human gallery at the Wellcome Collection that opened last September, a gallery which our research centre here at Leicester had the chance to collaborate on with the Wellcome team, and through which we all learned a huge amount about inclusive and accessible design. The image here shows a woman in a wheelchair looking at some of the exhibits that explore health and identity in a fast-changing world. Today, more than ever before, we have a fuller, a richer understanding of how we can make museums, arts, culture accessible and inclusive. We have a legal framework. We have a growing body of guidance and support on how to do it. We have amazing organisations like Vocalise and Stage Text and Shape, Accentuate, the Disability Collaborative Network, Autism in Museums. We have the superb Unlimited programme, we have the National Disability Arts Collection and Archive, and many more support mechanisms, advice, guidance to foster that shared task of inclusion for everybody. But despite that more positive picture, many working in this area continue to be frustrated, finding that many museums continue to pay insufficient attention to disabled people. Sadly, there are too many examples of inaccessible museums. There are too many exhibitions that continue to exclude disabled people's perspectives, their history and culture in ethical ways. Next slide, please. The Museum and Heritage Access Survey, published just last month, presents the findings from a survey of heritage and museum visitors who are also users of access facilities. It's a fantastic resource. I'd urge you to look at that. We'll pop the link into the chat later if you want to check it out. The report's particularly helpful and pertinent for this session because it highlights the key moment we find ourselves in, a key moment of challenge, but also opportunity for the sector. The report says, in light of COVID, there's a significant risk that disabled visitors will be more excluded, offered fewer access services, facilities and events. But it also says the sector has an opportunity to rebuild itself in a more inclusive and visitor-focused way. Next slide, please. The vast majority of respondents to this survey stated that they would visit museums and heritage sites more regularly. And there was considerable consensus from participants around what would be the top 3 things that would make that happen. These are more access information, so online and available via phone or email inquiry. More accessible events, audio described, captioned, signed, relaxed or autism-friendly events that are well promoted. And better staff awareness in our institutions, achieved through training, CPD opportunities, growing confidence and capacity amongst staff. So for this session, we want to think, how do we come together to grasp this moment, to resist a future in which disabled people are left out and instead move forwards down a path that sees a genuine interest, a deeply felt ethical commitment to creating museums and heritage sites and experiences for all, where access is seamlessly, naturally woven into all that we do, where our commitment to be for everyone is proudly visible, so that all visitors can see our values manifest in our daily practice. We really want to hear your thoughts and comments on these issues, but first we're going to hear from our 2 speakers to share their experiences and insights. I'm really pleased to have them here today. Sam Bowen, Museum Development Officer, will speak first, and then we'll hear from James Brandon before having some Q&A. Many thanks indeed.
Thank you, Richard. I'll just first, for those that don't know you, don't know me, sorry, introduce myself and what my experience of disability is, because I have a focus on SEND, so special educational needs and disability. There's a reason for that I'll go for in a minute. I've been working with museums in the sector for over 20 years. I've been an experienced curator, an education manager, and more recently, for the last decade or so, a museum development officer. Therefore, I will never suggest anything to do in terms of access that I don't know to be possible to do in practice. So that is a promise from me. I've also got lived experience for the last 11 years as being a SEND parent. My daughter was born and she's diagnosed at birth with complex needs and disability. And so there's a few points about that I just want to raise here in the personal side of things, which will highlight why that's important. She's actually wrongly diagnosed within an hour of being born just by visual appearance, having Down syndrome by a doctor. She actually has a unique genetic condition which you can't tell just by looking at somebody. And she's since been mistaken for having Down syndrome by dozens of doctors and strangers that run up to us in the street who similarly want to share the news with them, with us, that they also have people with Down syndrome in their families, which is lovely, but sadly misplaced diagnosis. And it's really dangerous, actually. Labeling hurts. It misses the person immediately. And I think that's really important that we look at that today about actually what we're talking about with disability. We're talking about needs-based and not diagnosis-based. Labeling is also very dangerous as it groups people in by type. And even within the Down syndrome community themselves, people would agree, parents would agree that there's a massive variance in needs for children and adults with that, just that one condition alone. So that's important to say from the get-go. And as a parent, sadly, I have experienced discrimination being a SEND parent almost from birth of my child for the last 11 years. And that could be with any new medical encounter with a new doctor who I've lost count of the times I've been asked, did you know about your daughter's condition whilst pregnant? And that in itself is a topical issue that is talked about a lot on social media at the moment. And that has with it a certain prejudice. And it's amazing how many people become armchair geneticists as well as soon as you say your child has a rare condition. I took a career break, which was necessary because I had to see my daughter through some major surgeries, including hip, open heart and eye surgery. And we've also sadly had some very near-death experiences due to illness and epilepsy over the last few years. So during that time, we tried to live as normal life as possible, have days out to visitor attractions, and obviously this included museums and galleries because that's what I love. However, I started to see museums in a new light as a visitor with a child with disabilities, not particularly physically accessible, but also poor amenities and a total lack of flexibility in learning engagement, which I found shocking, having been a learning person myself. So one of the things that I thought was an issue that needs tackling basically is that key learning outcomes and outputs from family craft activities, for instance, would be so prescriptive as to not then be inclusive for all abilities within that. We've been made to feel unwelcome and even embarrassed for trying to fit in sometimes, which is just shocking and awful. Now my daughter has grown older and she's gained a self-identity as a wheelchair user, which is great. However, then also recognizing that she's different to non-disabled children, when we then try and access activities which aren't physically accessible to her in a wheelchair, that's becoming damaging to her self-confidence, and it's absolutely terrible to see. One example of that is a living large piece of artwork that we approached in a gallery about 2 years ago, which people were invited to climb in and wander about. But the entrance to that was about 1.5 feet, 2 foot high, so completely inaccessible to a wheelchair user. And so my child had to just sit there while she watched other kids enjoying this amazing experience, and we couldn't, and that's wrong. So after these experiences, I returned to the role of Museum Development Officer in 2017, and I resolved to make a difference, because one thing that museum development can do is make a difference, and it's a brilliant job because we can make a difference in all sorts of areas. So that winter in 2017, I ran a 3-month project with 3 SEND schools, linking them to 3 museums. In the spring, I then wrote the Special Schools and Museums Toolkit, which I think Rebecca, you can share a link to. It is on the South East Museums Development website as well. And that was hugely successful. People said they wanted it. They didn't have a toolkit before then telling them how to be able to engage with SEND schools in particular, that was. In spring 2019, I then ran a Southeast-wide project with South East Museum Development. I linked 13 museums with 13 different SEND groups, ranging from infants to post-16 learning, and across a huge range of subjects and collections. And that was also shortlisted for the Museums and Heritage Award this year, which was great. This year, I wrote the SEND Family Guide for Kids in Museums, and I'm delighted I will be working with them and GEM in the future in running training. And even better news is I've just won a National Lottery project grant from Arts Council England to deliver a 2-year SEND in Museums project. So I'm so relieved. Finally now it'll all come under one package. So I'll talk more about that at the end. So 3 years, scores of museums, hundreds of SEND learners, 2 sector resources, several training sessions and conferences like this. Why is there still work to do? Question mark. Today I want to show you why this work is important in terms of social impact, and I'm going to ask you to consider any institutional misconceptions you may have about SEND. I'm going to show you some first steps you can take to tackle to move forward with this. Social inclusion and SEND inclusion automatically positively impacts on all disability inclusion, but a lot of other people benefit from this as well. So it's well-being, mental health, dementia, families with non-disabled children in buggy access. There's so many wins when you get this right that it's really worth looking at. Rebecca, please can I have slide 1? Okay, so here's some statistics that I hope you can see the whole screen, but I think it's important to share with you is 8% of the children in the UK are SEND or have SEND. So if you add with them their siblings and friends, you could be affecting as much as at least 20% of the UK child population in access needs. And what do I mean by this? Well, families are not going to want to come out and visit without their disabled child or member of the family in their group. Why would they? Why would you split a family up just to be able to access you? So if you don't make your offer, your programming, your activities, your space, your staff, welcoming to send families, you're going to miss the whole family. So this is a big figures headline. And over 10% of homes also have a disability within the family. My child is an only child, so we'll just head on out and try and get as best experience as possible. And we're lucky that both museum professionals, we can try and forge that. We have agency to be able to try and do that as best as possible. However, many of my friends who have non-disabled children in the family as well really struggle to find places where they can share experiences together. And the guilt that then brings on a family, you know, who do you cater for? Who's going to lose out or miss out this time? And we shouldn't be expecting and asking families to do that. Next slide, please. One of the reasons possibly that there's still such an issue with this is such a large percentage of people just say they don't know anyone with a disability, 43%, despite 1 in 5% of people in this country being disabled. So personally, when I reflected on this, I thought, yes, prior to having my daughter, in fact, prior to meeting my husband, whose dad was blind, so I guess that was my first contact with somebody who's disabled. And then when we had our daughter, my husband and I, that's the first disabled child I'd known. So I absolutely was in that 43% of people. And it was a huge shock. No one prepares you for it. There's very little support. So I'm not surprised that 97% of parents with a disabled child feel that the public just don't understand what it's about. Basically, this life, the being a SEND parent, and the main part involves being tired all the time. Even when you're included in meetings about your child, decisions are often made for or about you, but seldom with you. It can take years of relationship building to get a team of trusted professionals around your child. And often this is a tightrope walk that parents tread. And if they overstep their line or raise their voices too much or ask for too much, they're seen as problem parents. And I urge you to follow any SEND activists that are out there on Twitter, SEND parents, and problem parent comes up quite a lot. Some people wear it as a badge of honour, but for those who are disenfranchised, unconfident, or just too knackered to fight for their kids even more, the outcome for those children really shows. And sadly, some parents don't make it at all. The challenges are just too much. Next slide, please. So again, 87% of parents feel judged by members of the public, and I'm not surprised about that either, sadly. If I had £1 for every time my daughter has been stared at when we go out, I'd be a very rich woman indeed. And I'm afraid I still don't deal with it very well. The othering our society unashamedly displays is absolutely shocking. I truly believe that more museums and the more cultural organisations open up and welcome SEND families, the more socially accepting of disabilities the communities that they're located within will become. So it is a big aspiration, but I think museums and cultural organisations have a role to play here, and it's really important. Next slide, please. Kids and Museums did a really great survey this year, just as we were coming out of lockdown, with SEND families online, talking about their visits and what they visited museums primarily for. And as you can see here by the statistics, some 44% visit for education, but the majority of people, the vast majority, visit for fun and going out with their family, and it's extended family as direct family. And over 56% of people want and need SEND-aware staff. Next slide, please. So we already as a sector celebrate well-being, don't we? We know that we have an impact on that, a social impact, and it's really great that a good social experience of a museum can have long-term effects after that museum visit on well-being. So SEND children and young people are no different. They have exactly the same sense of wonder, excitement, and surprise when encountering the magic within the walls of your museum as any other child does. I've already mentioned the ability to take a whole family to a place where they're all welcomed and loved a little is a huge gift, and it's one that they value and need. Just getting out of the house into a new space with different sensory input is actually enough for some people. And for some people, it's a huge achievement. And we actually really need to value and cherish that. Next slide, please. So This slide is particularly poignant for me. It's of my mum and my daughter playing together in the handling collection of the Powell Cotton Museum in Birchington. And I make absolutely, no secret of the fact it's our favourite place to go, because we can go and play with their amazing things and just be who we want to be. And our experience is shaped by our enjoyment of it. And we go back time and again. So if that doesn't speak volumes, when it works, you get repeat visits. It's also very poignant though, obviously, because at the moment, I don't know when we can go there again. And my mum has been shielding since March. COVID has ripped families apart, we know this. But for SEND families, they've been hit particularly badly this year. 2 weeks into lockdown 1, the legal right to care, respite, education and therapy was taken away from SEND families. You probably don't know that, but it's true. We've been playing catch up ever since, and some services are still yet to go back on stream. Added to this, medically vulnerable children were asked to shield with little no support for families, and the horror stories of GPs putting DNRs on children as young as 4 with disabilities as headlines. Some people will put DNRs just for having learning disability or autism, nothing to do with any medical need to do with lung or respiratory issues. This year has left me cold, quite frankly, with the realisation that prejudice I may have imagined about us are very real. Again, I suggest that the role of museums can play in building confidence back up within the SEND families and disabled communities generally is crucially important. Next slide, please. So I'm just going to quickly look at the elephant in the room that we're talking about here. We need to think, why are we still hitting against this wall? Why are museums still not valuing learning in a holistic, global way? And why is SEND inclusion still lacking in many museums, notably some of the nationals who really should be leading the way on this and sadly just aren't, so many of them. Creating a programme of family activities that are end goal driven. So for instance, here you go, here's an animal that you've seen in a collection. Here's some clay, go and make that animal that you've seen in the collection. These kind of activities build exclusion from the get-go and therefore judgment and failure right from the start. If I can't see those animals, or I perceive them differently to you, or I can't manipulate the clay to make anything that resembles an animal, then have I failed straight away? I cannot meet the demands and expectations of your craft session. Most artists would agree that the main creative value is inherent in the process of making, not the end result. So really we need to be allowing for much more sensory interaction and experimenting with things within our sessions. Taste, smell, texture, all build a more complete image for some children with SEND. In fact, all children gain more from being restricted less and exploring more. I agree that some may actually need an end goal and an objective to go to, but then we don't judge that. We don't evaluate that at the end. I would then question, why are we so hung up in museums about what people learn? Is it possible that if we can't see or measure the learning that is actually happening, we disregard it altogether? Do we then say, well, this museum isn't for you because I can't teach you X and Y? Or even worse, we'll let you in at certain times as long as you don't impact on me trying to teach them X and Y. I am obviously deliberately being challenging here because I want us to get to the root of why our sector is still not recognising the need for investing in inclusion for SEND and learning disabled, and adapting facilities, programming and interpretation to be inclusive for different learning needs and styles. Why do I still get asked by education staff, how do I sell the importance of this work to my manager or board of trustees? Is it possible, dear viewers, that they just don't see the point? Next slide, please. So here's 3 things that you can do now. Have that conversation with all of your staff. 8% of children, 1 in 5 adults with disability. Someone on your staff is going to have, I assure you, will have direct experience of disability. It doesn't really matter to me who that is on that staff, whether it's the director or the shop assistant or the cleaner or the catering staff. You need to be able to be having the conversation with everybody to the how do you value the ways of experiencing your museum. Do check your website. And I'm not just talking about how accessible it is in terms of size of font and all of that's important, but how welcoming is your message and how easy is it to find the information that SEND families need and disabled families need to be able to come and make proper planning as to whether or not you're actually going to be suitable and accessible for them. and reach out and make contact with SEND families and groups. Next slide, please. I suggest that we adopt a pledge. And this is my pledge that I suggest to you today. My museum can and should be for everybody and provide equal opportunities for meaning and engagement. So a pledge usually sits within a policy or a vision statement. So it actually filters both up and down within an organisation. But it could also appear on your website, on your access statement, on your staff notice board, and heck, maybe even your CEO's coffee mug, so they see it every day when they're drinking from their coffee. Next slide, please. Thank you for listening. I hope my gentle nudging and prodding has raised questions, and I know some of them are uncomfortable, but I'd like you to go back now and try and find the answers to these with your staff. If you would like to follow the @Sending Museums, where the work will start to create a sector-wide hub for support, it's starting in December and it will be going on for 2 years. Please do join me with there. And if you want to have discussions about this topic after the session, then please use the hashtag Sending Museums. My own personal Twitter account is Make, Do and Send, and I'd love you to follow me and I'll follow you back and we can keep having these conversations. Thank you ever so much.
Sam, thank you so much. Very powerful nudging and questions, and just a superb presentation. I urged the speakers at the beginning not to get distracted with the chat. The chat is on fire, Sam, and just to take one of the comments, this talk is so brilliant. People are incredibly prompted by what you've said, and you've given us a huge amount to take forward. So thank you for that. We're going to jump straight into our next speaker. If you have questions, pop them in the Q&A button and we'll move on to James. Thanks very much.
Hello, I think we can move on to my title slide. My name is James Brandon. I'm the Diversity Inclusion Manager at Tate Art Galleries. And I'm here today to support the panel and really, as always, really inspired and motivated by both Richard and Sam, as I have been over the 4 years whilst I've been at Tate. Today, I speak to you as both that Diversity Inclusion Manager, but also as a ally who's been practicing in and around civic spaces for over 15 years. The core to my practice, and similar to how Richard talked at the start of today, was around the centering of communities who are often marginalized or discriminated, or particularly requirements are not met to give them the space that they need to engage in those civic spaces. Most recently, I've joined Tate into art galleries, but my previous experience has mostly been within sport and leisure centres and leisure services, working with big partnerships such as Autism Initiative and other charities to really change service delivery to ensure that the needs are being met by all communities. And what I want to hopefully get across today is how this is not something that is difficult. This is not something that requires huge amount of energies, but what it does require is systematic change and real good analysis of who is making decisions, who is making those decisions to create discriminatory spaces, and how do we change our system. I also want to very much highlight today, at this point on Wednesday, going into lockdown 2.0 tomorrow, I appreciate the work that has gone in across a number of galleries and museums, to reopen and to also be going now into closure, and today being a key marker for that. And I know following the first reopening, the gallery sector coming together to talk about, well, how can we center access in terms of our reopening? And the COVID-19 pandemic is particularly also placing even further access implications, and it's important that we get this right from the outset. However, I'm going to start by showing this image. If you can move to the next slide. And I'm going to start with this because I'm not positioning here today that Tate is by any means getting this right every time. And I think that's the key point I'm going to start off here, is that access is judged on getting this right every time, because it is required, it's supporting. As soon as you create one area where a visitor cannot access your space, you're discriminating that against that visitor. And many will know this image. This is from last summer's Oliver Eliasson's exhibition at Tate Galleries. It's called Your Spiral View. And within this exhibition, within Tate Modern, this structure was shown. And within this structure, you are required to step up on 2 steel steps, move through a passageway, which is a kaleidoscope of mirrors, and exit at the other end. You'll note that there's no handrails, that the flooring is particularly non-tactile, and that there is, at the very essence of it, two steps up. So arguably, we were going to get some responses to this, and I'm going to share with you some of the responses if we can move to the next slide. We featured in the New York Times at the same time as Being Human was opening. Eliasson was also open. And within there, a visitor had shared on their Twitter posts that they had approached this object and had never actually seen so overt an experience of inaccessibility. And equally, and arguably, the way our staff handled that experience also led to them feeling that they'd been discriminated against. This is a comment, I'm just going to read this out. Miss O'Connor let out her frustrations in a series of 37 exasperated Twitter posts that went viral. She was sick of it. She wrote in one post that also included an expletive: "I want able people to stop being defensive and pissy when we ask for the bare minimum." She added in another, "Accessibility is not ugly or cluttered or distracting. Accessibility belongs in art and everywhere." If we can move on to the next slide. Further, in other areas, other articles quoted here, others are questioning whether Tate's Access Advisory Group still exists. Tony Heaton, a former member, says such a body would have demanded access to this work if consulted. Others, meanwhile, are questioning the legality of Tate's position. Emily Johnson, a former social media and digital news editor, said major world museums like at Tate, especially those with charitable status, must be leaders in art access. Inaccessibility isn't just mobility, but safety. So I'm putting this out there before I start talking, because there's no point coming from a place where we can't acknowledge where we need to make shifts change. And I'm going to address a few of those things. But what for me shows the dichotomy or the kind of positioning of this is, if we move on to the next slide, in the same week, in the Accessible Tourism Report that was ranking the top 100 visitor attractions, both Tate Modern and Tate Britain were featuring in the top 10. So whilst on one hand, we may feel like we have we have an accessible building, an accessible offer, and it's being adjudged like that, this one object within our exhibition and the handling of that object and the handling of and the working with the visitor created this wave of actually we're not getting it right. For me, as a practitioner, I've always believed that Tate is employing the social model of disability. And I'm just going to, if we move to the next slide, I'll show you what our definition is. And this is something that has been in post for over 15 to 20 years. And that is the social model of disability is recognizing that people are disabled by environments, attitudes and stereotypes which prevent them from completing tasks or accessing resources in the same way a non-disabled individual would. Tate uses the social media model, as standard. Arguably, I've just shown you that maybe we aren't doing it as well as we could be. That moment in 2019, though, allowed me and the head of our visitor experience team a moment to make some change happen. To be able to say that we both publicly had this criticism, but equally internally, this is something we've known that we haven't been meeting where we would like to be, or our aspirations. We had a great learning program that does all of the BSL tours, the touch tours, the engagement. But actually, when we are still able to open up exhibitions that create these spaces, something needs to be addressed. If we can move on to the next slide, I'll talk through some of the things that we did in response to this. Now, access guidelines are very well available. When I arrived at TAFE a few years ago, I was surprised to see that we had access guidelines, but not many people knew about them. But equally, they were over 75 pages long. So I think for sure that there was something around the people who were designing exhibitions and designing spaces actually having access to the guidelines in a way that means that they can act and actually make them happen. So the first things that we've been doing in this last year was to create an accessible exhibition checklist. And this is to ensure that people can when they're designing their exhibitions or they're auditing their exhibition spaces, they are asking themselves the right questions. And whether this ranges from vitrine heights to specific areas around interpretation text to contrast guidelines. So this is about re-establishing what the minimum standards are for the organization. But just setting that didn't mean that we were going to be getting the hearts and minds of people. There were still people saying, well, and particularly in the arts, there is always the pushback around the purpose of an object and an artist's intention versus the visitor experience and the need to do that. So for me, there was a big campaign around the hearts and minds. So both drawing on telling the stories around, well, if we don't get this right, who are we discriminating? Talking through the legality of it as well by sharing the Equality Act and our actual duty and our public duty as holders of civic spaces. And then generally ensuring that we were bringing in the right structure and right support so that people could get this right more often. One of the key changes for us was about centering visitor experience in this process. Visitor experience are the experts in our visitors. And so to not have them in the process of supporting curators or exhibition designers or website developers is really important. That it was a bit of an own goal. Why were they not more centered in that process? So we were able to shift almost the power structure around this to say that visitor experience being involved much earlier in exhibitions and design should be able to ask some of those questions, which someone who was designing exhibition might not be even thinking about. And then it was about building capability. So we worked with the Centre for Accessible Environments and we brought in them to deliver some access auditing courses. We did an analysis of anybody who produces content or exhibitions, and we picked out key people that we asked to really come forward and undertake some of that access auditing understanding. So whilst we had it on paper, this guidelines and these standards, it was also about making sure that there was a CPD opportunity where access auditors were in-house, that we weren't just going to a critical group like an access advisory group or an external consultancy. We were really making sure that we were building capability internally, so that basically when any conversations were happening, there was at least some knowledge in the room. Then it was very much about including lived experience. So working with our own disability network and thinking really through how do voices in critical spaces be centered. And a big shout out to Nick Goss Consultancy, who've been working with us really closely over the last 2 years to be thinking about where can we do walkarounds, where can we bring people in, where can we draw in our own visitors and understand their experience and bring our own visitors into that journey, because they care about us. They're coming to our sites, they care about us, they want to see us do better, and they want to have a voice in changing the organization. We also then engaged our specialists. We have I'm going to be another big shout out to Marcus Hawley. So for over a number of years has been the biggest champion at Tate for access in terms of designing and delivering what that looks like. Where are the key questions which aren't being met by the access guidelines? Are there particular moments where we need to go and engage specialists? So arguably our spiral view needed a real specialist lens on it. What is this object and why are we doing it? And then for me, the other area is really cultivating a culture where people are asking questions. and continual questions. People only know what they know. And without that lived experience, and particularly when we operate in a sector with such a deficit model of representation, asking questions all the time and not trying to have all the answers. Questions with exploratory spaces, questions with that can draw in those experts, can draw in those lived experience. I then just want to touch on the access advisory groups. Now, a number of areas will have access advisory groups. We've seen a real growth of those, particularly as when they're talking to sort of transport organizations, they're really embedding them. But access advisory groups have to have a real terms of reference, and they have a real position where you can take challenges that might arise and work with those access advisory groups to come to solutions. The comment that I shared with you was quite a policing tone to it, but actually, for me, access advisory group has got to come in so early into a space, and it should be about solutions focus. Individuals should be remunerated for their time. It should feel like that someone's contributions is being heard and impacted. But the key thing for me is that an access advisory group has to have a real clear mandate. And if an access advisory panel has that opportunity and has that will to change, they can be deployed really well. However, if they are just held potentially by groups who don't necessarily have the power to create change, they could be held as a satellite and they don't really make any movement forward. So it's really about where that access advisory group could be positioned to make consistent change. For us, we've been particularly focused in on the moment on internal capability, engaging a number of specialists to help us when those at this stage, with a view that we will be looking to a much bigger access advisory group when we can get a process in where we can have where we really can ask questions and really work in a solutions and problem solving process. I'm just going to finish out my last slide then. For me, I think making accessibility is about adjustments to the visitor experience. It's not about additional services or learning interventions. It is about making sure that we are fulfilling our civic commitments around our spaces. And I share of it when I'm thinking about careers. If you're applying for a job, you would look at workplace adjustments to ensure that you can ensure a candidate can thrive both in the interview process, but in the workplace. For me, it's exactly the same thing. How can we ensure all of our visitors can thrive every day? And that is about seeing accessibility as an adjustment to the visit, not necessarily about creating a range of additional services that don't have sustainability at the heart of what they're doing. And that's my big provocation today, is definitely center your visitor experience teams in terms of this access conversations, give them power to say no to other areas who might be making decisions and without real knowledge. And that is me, I think. Yes, back over to you, Richard.
Great, thanks very much, James. Rebecca, can we lose the slides and bring us back for a moment? James, thank you so much. Refreshing honesty and packed with really practical suggestions for how we can address the issues that we started with. Really brilliant stuff, thank you. I'm getting new insight now into the challenges of a chair where the chat and the questions are both on fire. There are tons and there are really brilliant feedback, discussions and some great questions, which we're only going to sadly be able to scratch the surface of. So I've picked a couple out to start us off. We'll see how many we get to. And the first one is to you, Sam, and it's a sort of blend of questions that have come in. Particularly Kate and Ruth were raising a question which I'm going to try and express, which is about the pros and cons of a kind of special provision for kids, for disabled kids, versus a more integrated model. And so the examples that were coming out were saying sometimes the specialist provision is great because it's it compensates for the lack of access elsewhere. It gives special, those kids don't have to queue or be part of other challenges. They can get access to those resources that are particularly for them, but the downside might be that they stand out, that they're not integrated, they don't feel part of something. I was really struck with your point, Sam, about the museum, where you can go and be who you want to be and just bring your whole self to the museum. So, but at the same time, the kind of integrated model brings other challenges. It means maybe like those kids have to queue and wait like everyone else, and that might not be as easy or straightforward. Do you have any thoughts on this balance between full integration and some specialist provision that might be particularly valued by SEND families?
Yeah, I mean, you've mentioned quite a few things there. So obviously inclusion, and it came up in the chat quite a lot, inclusion should be, as it says for the word, 24/7, everything. However, there are some times when actually being able to, so the fast pass thing, what you're talking about, fast tracking for queuing, is really very useful for some families and also some adults with disabilities who may find queuing, standing for long periods of time, or just the anticipatory action of queuing very, very stressful and very difficult. Now that is reasonable adjustments for their disability. So I think absolutely that's fine and appropriate. I also have experienced as a user, I mean, I have to flag up Eureka if there's anybody from Eureka here today. I'd say they're the gold standard in offering resources and experiences that are aimed at SEND families. And we have benefited from those. One of the things, for instance, because they are quite a way away geographically to us, but we visited and had an extra pair of helping hands. So that is something, and we were visiting the galleries just, in an ordinary sort of time along with everybody else, but to be able to have another member of staff to be able to come around and actually help you access things in a slightly different way or explain how to use a display or an interactive was really very useful. Similarly, things like the lanyard schemes and stuff as well. I mean, there's so many, it's got so many layers to it. My example, I think, it can be done. I mean, an ex-curator, an ex-education person, I know it is possible to deliver family activity sessions that are flexible enough that everybody can join in. And that is, I guess, where my gold standard would be. Because go back to the families that have a blend of disabled and non-disabled children within them. If you say, right, we're only offering this, then for those families, what do? Do they take the non-disabled child to that disability group there? I mean, it's like, again, you sort of, it's almost like segregation. I think there are skills and learning tools that can be evolved from that in the delivery, and it does take confident delivery people to be able to adapt. Storytelling sessions, for instance, there's loads, I mean, there's just loads of options that you could utilize and make accessible and inclusive and fun. But a lot of it, and James, you're absolutely right, it comes down to visitor experience and confident staff being able to adapt, think quickly on their feet and be able to go, you know what, that person is behaving in a way that isn't perhaps necessarily go with the flow of our activity, but let's just roll with it. Let's react with it. Let's bring them in some way. But that does take staff confidence, and that takes training. So, that just slapping on things like, oh, here's a quiet hour, for instance, it's a bit like putting a band-aid on something. I think, I'm afraid, I feel that. However, if you have really noisy interactives that are there for everybody to enjoy, yes, you do need a quiet time. And then it's choice, isn't it? It's offering your customers, our customers, choice to be able to then say, okay, I'll pick that suits me, or I think I can go with that. But the other thing is, it's really, really important that is all that information is put on your website, because people aren't mind readers.
Thanks for unpacking that, Sam. It's such an interesting issue. I was on a project recently where we said, what would it look like to super serve disabled people, to absolutely amplify their experience and then thread it through everything? It was a really nice challenge to think about. Why wouldn't we do that? Why wouldn't we super serve and really kind of prioritize that? James, I'm going to turn to you. There's lots of, there's too many, but there's lots of questions that are asking for quite practical guidance. One person, Kate, says a lot of museums will say they don't have a big budget for this. What simple solutions have you seen that don't cost too much? What would you like to see? Yeah. Can you make any reference from your perspective around cost and how we might address that?
So right. I love this question because costs come up all the time. All the time, the costs come. You know, I would say, so I've got loads of things to say there because I want to also just reflect back on what Sam just said there as well. I think if you are designing a space, designing it in terms of taking a universal or an accessible design approach, it shouldn't cost you any more than it would have done if you were going to do it anyway. Because what it is about, for me, particularly at a functional level, and we can talk a bit more about the kind of adjustments you might need in the space, but actually it's just about better design. It's about setting out your standards and your minimum standards that you're hitting from the outset. So if you are, for instance, reviewing or rehanging or restructuring something, going and understanding the point, you know, what is your key when you're creating your commission? What is your key standards for your vitrine heights, or every book being tilted, or how your light is going to come against your glazing, or how your interpretation text, when you next rewrite it, that you're going to commit when it's getting printed to up that print size and make sure that contrast is as best as you can afford. What for me it comes about is about those changes. I can't see any museum going in and drastically overhauling its whole museum in one moment. And I think, Richard, we've talked about this before, you know, being human is a unique moment, but that was core and centered into that design of that gallery was accessibility. Going back and trying to retrofit accessibility into poorly designed or poorly accessibly designed buildings and displays, it requires a strategy. And part of that strategy is zero tolerance against your standards that you're going to set. So agreeing some standards and saying, right, we've got zero tolerance for anything of this, we're going to commit to that. Then it's about leadership saying, right, this is why, this is the hearts and minds around that. And then it is about, well, redesign how you're designing your budgets. You know, for me, I tried to say I wasn't going to share too much, like too controversial today. But you know, simple things is like the number of benches that I see in museums and galleries, just benches for people to sit, and it's great. There's not enough places for people to sit in museums and galleries, full stop. But the simple solution for a bench is a futon, not a futon, a chaise lounge, because you can sit, you can have armrests, and we're finding there's loads of solutions that are beautiful, that fit in with your spaces. So when you're next making your furniture investment plan, that is the moment to say, right, now is our zero tolerance time. It is important, if you do have that budget, to be investing in this in the right way. But realistic, if we're going to be realistic and thinking about our businesses and how they function, it is when those decisions come round, not losing that opportunity and making sure that that zero tolerance is embedded in your leadership, in those who are designing it, and that you're setting out what those standards are. And for me, that's I just want to bounce on Sam's point there, was that my controversial point is, if we keep plastering things, we're not stopping the structural change that needs to happen. So we keep going, oh, right, well, we really want to do this activity, but we're going to put this plaster on it in case we have a disabled child in the space. Or, okay, you know, for me at Tate Modern, you know, Tate Modern outside of a COVID year is a busy, loud, huge space. And it's only now that we have a quiet room that we've just launched into that space. And that space will be now, after years and years of our visitors saying, oh, I could just do with a space which is just a little bit away from the crowds, or I can feel I can just have that moment. And I was at the Communicating the Arts, and there was a wonderful, and I remember their Twitter handle, who was talking to me about resting spaces. And then when you're having a resting space, can we decorate the ceiling so someone has something to look at when they're resting?
Sorry, James, to interrupt. We could. It's so we're out of time, and I'm really sorry to interrupt like that so rudely. But a rallying cry, zero tolerance, that you both speak to. You've both helped set standards for what we need to aim for, and it's exactly what we wanted for this session. I'm seeing a lot of love in the chat and the questions. Thank you, everybody, for joining us for some brilliant discussions, questions. I'm sorry we didn't get to them, but I feel coming back to this theme with renewed inspiration and vigour from our speakers, Sam and James. Huge thanks to you both. Last words, Rebecca, and if you could say something about how people will access this. A lot of people asking how they can catch up with all the detail that's been in there. Thanks, everyone.
No, thank you so much. And we were just having a conversation on WhatsApp about how some sessions could just be longer because there's just so much to talk about. So if we could stay here all day and chat, it'd be amazing. Excuse me. Yeah, I was just saying on chat that if you want to say the closed captioning transcript, it's quite easy to do. You just press a little arrow next to closed caption, press show full transcript, and it's a copy and paste job. So I've done that myself. It's quite useful. And the recording of this as well will be online, hopefully next week, all being well. Thanks, Richard, Sam, and James. That was amazing as always, and really, really clear and concise. Our next session's in about 10 minutes, or I don't know what time it is actually, in 12:15 on retail in recovery. So do go along to that if you can. And yeah, that's it from me. Thank you all. See you soon. Bye.
Thanks, everyone. Bye-bye.
Bye.